Well, getting your menstrual cycle can be the most excruciating time for some women. Premenstrual dysphoric disorder is a severe and disabling form of premenstrual syndrome. It affects about 3 to 8% of women that are menstruating. The disorder causes extreme mood shifts that can disrupt your work and damage your relationships. Symptoms of PMDD usually begin 7 to 10 days before your period starts and continue for the first few days that you have your menstrual cycle. Well, joining me in studio is Dr. Abigail Lukhaimane. Well, thank you so much for joining us in studio and for being here on VUCA Africa. Just give us a short definition, if you will, of PMDD.
Well, thank you for having me. Well, in essence, you've said exactly what it is. In terms of it being a severe form of what we all know as premenstrual syndrome, and otherwise known as premenstrual tension, it's categorized typically by the fact that there is a lot of psychological component associated to it. So it's not only the physical symptoms that one experiences, which everybody knows as the bloated sensations, the water retention. There's a very large component which is a mood disorder that's associated with it and can get to a severe form of depression as such, and is disabling to that individual in terms of being able to function in terms of quality of life under those circumstances. And it's cyclical, so it's actually debilitating to that person on a monthly basis.
Let's take a look at some of the causes of premenstrual dysphoric disorder. What are some of the causes for women that suffer from this disorder?
Well, there aren't necessarily causes, but there is a predisposition per se, for instance, familial predisposition. So if you've had a mother who suffered from severe menstrual disorders, you're going to find that you are most likely prone to developing. If you as an individual are also prone to depressive mood disorders in general, or anxiety disorders, you are also then prone to also developing them. There has been an association with those that might be more sensitive to the effects of the luteal phase of their menstrual cycle, meaning after ovulation, those progesterone levels that are there, they can be prone to that and can then thus develop those depressive disorders.
Well, you have touched upon some of the symptoms that you can have when you have PMDD, but just tell us some more symptoms so that the viewers can be can know what these symptoms are.
So one, like I said, you're going to have breast tenderness, you can have water retention and experience bloated sensation, you can have digestive issues where you find either you have chronic constipation or they develop an acute diarrhea during that period of time. They're lethargic, they are loss of appetite, you don't have a willingness to be able to, a lack of energy to do anything, so chronically fatigued. In terms of mood disorder, you feel depressed, and to the extent that if the person has suicidal ideation, they can actually find themselves to the point where they're actually having suicide attempts during that time, depending on how severe they are. So it's that component that makes them listlessness, they have that insomnia, and all of these things contribute and continue to roll over and get worse with each cycle. So you tend to find that those people are they find it hard to function in their day-to-day.
Let's take a look now at the diagnosis. If somebody is being diagnosed with PMDD, can they go to a gynecologist or should they rather go to a psychologist? And what are some of the diagnoses that will be made to them?
So most likely you're going to find the person initially going to either the gynecologist or their GP, because they're going to go there typically, like you said, about 7 to 10 days prior to their periods. That's when the symptoms generally begin. They're going to be they're complaining of generalized symptoms that they're experiencing. They don't necessarily actually complain about the mood disorder, because of course they just feel like they're just lacking energy and they just feel like they don't have a drive to be able to do the things that they want to do. Under those circumstances, by first going to your GP or your medical practitioner, your gynecologist, you can first exclude actual organic disorders that might be there first. And by virtue of doing that, they then pick up to say, look, we've been seeing this on a monthly basis and it doesn't seem to be getting any better. That's when they're more likely to initiate not only a medical treatment, which would be started off either by a gynecologist or by your GP, depending on their expertise, but as well, they would then bring in a psychologist or a psychiatrist to be able to say, look, there is a cognitive behavior here that needs to be corrected, and it can't necessarily be done by medicine alone. And that's where you need to consider that the cognitive behavioral therapy is the part that needs to be impacted on the most.
Is there anything that women can do to ensure that they don't get PMDD, or is it something that you can't really stop?
You can't generally really stop it, but you can improve your symptoms and you can lessen the severity of the symptoms that you're experiencing. So obviously, simple things like eating right, making sure you've got a balanced diet, your multivitamin supplementation is correct, you're not prone to things like anemia, especially if you've got very painful, heavy periods, you're going to find that that's going to be a component that you need to be able to address. But also making sure you exercise. So that's part of the cognitive behavior therapy things. The person who's overweight tends to be more prone to developing these symptoms, and they tend to worsen because of the estrogen excess. So healthy lifestyle, general activity, making sure that you are actually aware of those things that when they're occurring, to realize, wait, I think I'm experiencing something that's out of the norm, and then you were able to address it. Obviously, there are other ways to be, in terms of medically treating it. A simple thing like being able to put somebody on an oral contraceptive will suppress ovulation and hence decrease the side effects that the person experiences from the disease disorder itself.
And then the common treatment, you've said now that they can put someone on a contraceptive pill. Is there anything else that doctors do prescribe to these women so that it does relieve some of the symptoms, or other does treat it? Can it be cured at all?
It can be treated, it can be controlled to the extent where the person at least does not have the depressive symptoms. So one can find somebody could control purely on using contraceptive alone, okay? But then the other impact is to be able to look at, do we need to give something on a behavioral sense? So you'd give serotonin reuptake inhibitors, which is a tablet that we give for depression, but because of the deficiency that we notice with the serotonin, we find that when you do give these patients this medication, they do actually improve.
Well, thank you so much for joining me in studio. That was Dr. Abigail Lukhaimane joining us and talking a bit more about premenstrual dysphoric disorder that women tend to pick up.